over for the people of Vermont and do a little explaining about some very important events which took place in Washington last week. The good news is, in fact, that after a dozen years of neglect, the Congress and the President are beginning to address some of the most serious problems facing this country. And these are problems that have been ignored for many years. The bad news is, or at least a word of caution, is much, much more needs to be done. We're in the beginning stages of the process. Now, what are the three areas that the Congress and the President have to address? Number one, we've got to deal with a $300 billion deficit and a $4 trillion national debt. That has to be addressed. Number two, we must reinvigorate an economy in which the standard of living for working people is in decline, the gap between the rich and the poor grows wider, and decent paying manufacturing jobs continue to leave the country. So we have to address the economy. Some people think not. I think the government must play a very strong role there. Thirdly, we must begin to focus attention on those segments of our population which have been ignored for many, many years, and those people who are hurting the most. That is our children, 20% of whom live in poverty. That is our homeless people, 2 million who are homeless. And that is those segments of the population that are really suffering rather terribly and whose needs have been ignored for so many years. Now, in my view, progress in all of these areas is being made, but much more work needs to be done. On Thursday, as you know, the House passed the President's budget, which through major cuts in both military spending and domestic spending, will reduce the deficit by about 50% over a 5-year period. I think that's a good start. In my view, there are areas which I think have not been approached in terms of deficit reduction, which need to be paid attention to. I would, for example, kill the supercollider. I would kill the space station. I would kill Star Wars. I don't think we need to spend $130 billion a year defending Western Europe and Asia. So I think we can make more cuts which will help us reduce the deficit that much faster. Some progress has been made, more needs to be done. In terms of stimulating the economy, there is a vigorous debate that is going on. Some people, generally conservative Republicans, say, hey, the economy is picking up. The economy is growing, and the federal government is not obliged to do anything about it. Things are just wonderful. Prosperity is around the corner. I disagree. I think several of the key facts that should be appreciated is, number one, that the number of new jobs that are being created are not terribly many, and of deep concern is that many of the new jobs that are being created during this recovery are low-wage, part-time jobs. And that's the trend that we've seen for the last number of years, that the new jobs being created are not decent-paying jobs, are not jobs with good benefits, but they are low-wage, part-time jobs, and that is what this recovery is about. It seems to me that given the fact that our infrastructure continues to decline, given the fact that over the last 15 years we have paid very little attention to our roads, our bridges, our sewer systems, our landfills, our environmental needs, it seems to me to be absolutely appropriate that we put billions of dollars into improving our infrastructure and at the same time create hundreds and hundreds of thousands of decent paying jobs. That to me is appropriate. These are not make-work jobs. America will not prosper if we do not have good mass transportation, good highways, good bridges. This is work that has to be done. It may as well be done now, in the middle of recession, putting our people to work. Lastly, it seems to me that there is no embarrassment that this country faces more shameful than the fact that we lead the world by double in terms of the percentage of our children who are living in poverty. We have twice the rate of childhood poverty of any other nation in the industrialized world. 5 million children a day go hungry, millions of kids lack access to health care, and hundreds of thousands of children in America are sleeping out on the streets. And this is not what America is supposed to be about. I am proud that this budget, the stimulus package, begins to address this crisis. Head Start finally will be fully funded. The WIC program, which has worked so well here in the state of Vermont, will be fully funded. Children's immunization programs will be fully funded. Almost $2 billion more will be appropriated to the Pell Grant program, which means that working class and low-income kids who otherwise would not have the opportunity to go to college will now have the opportunity to go to college. In my view, that is a good investment for America. I would go further, but at least there is an effort to begin to address these serious problems. Now, when we talk about investment in America, and when we talk about tax policy in America, it seems to me that we must always go back to a couple of very, very simple points in terms of what has been happening in this country for the last 15 years. And very often the media forgets about it, very often the Republicans forget about it, very often the Democrats forget about it. I do not intend to forget about it. And the basic facts are that over a period from 1983 to 89, several studies were done talking about what happened in the economy. One interesting study was done by some people at the Federal Reserve Bank and the IRS. And what they told us is that in 1989, the wealthiest 1% of our population now own 37% of the wealth in this nation. And that is far more than the 32% of the wealth owned by the bottom 90%. The richest 1% saw a 15% growth in their share of the nation's wealth, while in the same period, the bottom 90%, the vast majority of the people, saw a 4.5% decline in their share of the nation's wealth. That's the reality of what happened during the 1980s. Another study indicated that the richest during that same period, the wealthiest 1/2% saw a $1.4 trillion increase in their wealth. Richest 1/2% saw a $1.4 trillion increase in their wealth. $1.4 trillion is a lot of money. Now we're talking about, this is not just a few $100 billion. This is $1.4 trillion accumulating to the richest 1/2%. Meanwhile, the bottom 40% lost $256 billion in wealth. Money goes from the poor, working class, goes to the rich. So what that tells me is that when we talk about tax policy, when we talk about investing in the future of this country, that it is absolutely appropriate to begin to pay attention to working people, poor people, and those people who have suffered so much over the last decade. And while Democrats and Republicans and others may worry about the very wealthiest people in Congress, I'm not. Those are the people who've made out like bandits. Those are the people who deserve to pay more in taxes so that all people in this country can have a fair shot at life, so that we can begin to address the deficit crisis. So that's an overview. I'm happy to discuss. There are other things going on, but that's one issue that I wanted to chat a little bit about.
Okay. So essentially you would go farther in all three directions.
That's right.
More budget cuts, more spending, and higher taxes.
As a matter of fact, not only would I did. As you, for all of you who watched the C-SPAN, you might notice that there was another budget proposal that was brought up, and that was a budget proposal of the Congressional Black Caucus and the Congressional Progressive Caucus, of which I am one of the founders. We only got 87 votes. But that's exactly what we did. In every instance, we went further. We fought for more deficit reduction, we fought for more jobs in America to rebuild our country, and we fought for more money for the children and the poor. And that was exactly the thrust of our effort. We lost. But I think there is a feeling that with what was passed, with the President's proposals, at least we are beginning to make some real progress in deficit reduction, in re-stimulating the economy and job creation, and in paying attention to our children and those people who are hurting most. So there was that satisfaction.
How do you think this, I mean, you're not, what am I trying to say here? How do you think this is all going to fare over in the Senate? You know, the bill's done, it's a done deal.
No, it's not. There's going to continue to be fighting. You know, the President makes his proposal, and then it's up to the Congress to accept it or reject it or modify it. The House made changes and passed its proposal on Thursday. The Senate now takes it up. There is an area, though, where there will be increased debate, both in the Senate and the House, and that was not dealt with last week. And that is, while the budget in the House was agreed upon, what was not agreed upon is in fact tax policy and how much money is raised and from where that money comes. So I want to say at this point there are two areas. In general, as I've said before, I think the President's proposal is a pretty good proposal. Very refreshing proposal after 12 years of Reaganomics. Where are the concerns that I have? Two areas. Number one, I am not enthusiastic about the energy tax. I think the energy tax will come down heavy on working people who have to drive their cars to work, and that's especially true in rural states like Vermont. Second of all, I think that the tax on Social Security recipients to some degree is regressive. Not all of the senior citizens who are going to be hit by this tax are wealthy. It begins to trigger in for couples who earn $32,000 a year or more, individuals $25,000 a year. That's not wealthy. And I think a lot of people might be hurt in that proposal. So those are two areas that I intend to work with progressives and other people in the House to make modifications on. We think that while the President's tax proposals are reasonably progressive in terms of income tax increases, it is in fact the wealthy who are going to be paying the bulk of the increases. Some of these taxes do come down too heavy on the middle class, and we will fight to make that program more progressive.
So there's a major battle brewing here.
I think so. Now again, the budget, which says how much you spend and how much you raise, has been agreed upon. What has not been agreed upon is exactly where the money comes from. And I think while the President's proposal is fairly progressive, and I'm not here to, to condemn it totally, I think we could do it, make it better. I do have concerns about the energy tax for New England and Vermont. I do have concerns about the Social Security tax for middle-income senior citizens.
Do you get the feeling that people are going to say, all right, now we cut the deficit, now let's go on, do something else?
I don't understand what you mean by that.
This is sort of the end of the action on the deficit. People can say, wow, we've done something about it.
No, I hope not. The deficit is a very serious problem, and the debate is how quickly you can go. People like Ross Perot would go faster. I hope that people don't think that. You have a $4 trillion national debt, which we're not even beginning to touch. What we're trying to do is in 5 years is cutting our deficit, not debt, in half. So an enormous amount of work remains to be done. And I think there's going to be some very hot debates about what you cut. My own feeling, as I indicated earlier, is there are several programs which might, in the great scheme of things, be fine programs, but which we cannot afford right now. I think the supercollider is a boondoggle. It is much too expensive. I think the space station at some point might be a good program. I think we can't afford it right now. I don't think we need Star Wars at all right now. So I don't think we need to spend $130 billion a year defending Europe and Japan. So I will push my ideas as to how we can cut the deficit even further.
Does Congress need something like the Base Closure Commission to recommend that government programs should be shut down? You can either up or down on the whole thing?
I think the Base Closure Commission is such a sensitive and difficult area because by almost definition every member of Congress will tell you why it should not be the base in his or her district to be closed, and you need some objective commission. As you know, the President has already developed a program called Reinventing America, where he is looking to try to develop approaches to do away with the waste in government. So I think they're moving in that direction. I think base closings may be a little bit special, and that approach is appropriate. But I think just in terms of the deficit, what you need is courage. And you need finally to say, can we afford a space station? Can we afford a supercollider? Do we need Star Wars? Do we need to spend $130 billion a year defending Western Europe? And, there are people for every argument that you give, and I'm giving the arguments why I think we don't need those programs. There are going to be 5 members of Congress who tell you, well, no, really, these are really fine programs. We do need them. And that's what the democratic process is about. There's no magic formula. No magic formula. You're going to have to debate it out. You're going to fight it out. And we'll see what happens.
How much dollar-wise would you cut the defense budget more? Or percentage?
I can't give you the exact, I could give it to you, I don't have it right in front of me right now. I mean, Clinton has gone forward. He has made some cuts. I would go further. Again, I think the areas that I would move in, and I'll get you those numbers later, Ajay, is either we cut back on the defense of Europe and Asia, or we ask these countries to pick up a significantly greater percentage of that burden than they're presently taking. Right now, everything being equal, Germany is a wealthier country than the United States. If Germany feels that they need our soldiers there to defend them, let them pay the tab. Our working people really can't afford to do that. Same thing I would say with Asia.
With the unrest in the Soviet Union and much of Europe now, is now a good time to pull these troops out, just in case?
Well, there's almost never a good time. I think no one is suggesting that when we talk about cuts in military spending, that you're talking about disarming the United States. The proposals that I am advocating would leave this country far, far and away the strongest military presence on earth. You restructure your military to fight different types of wars and different types of battles. But the converse of that question is, at a time when our infrastructure is collapsing, when our educational system is hurting very badly, we see the fights here in the state of Vermont as to whether or not property taxes should be raised to fund education, at a time when 5 million children go hungry. The question is, can we afford to spend $130 billion a year defending Europe and Asia? I think we cannot do that. What are the major priorities facing this country? I think I've touched some of them. We have got to improve our industrial base. We have got to create jobs which pay workers a decent wage. Defending Germany and Japan do not do that. So your point is well taken. No one suggests that this world is a wonderful and safe place, that we should, cut military spending to zero and so forth. But I think, in fact, we can make substantial cuts.
What are your thoughts about what's going on in Russia these days? Do we need to take some type of firm action to help out over there?
Well, I think what's going on in Russia now is of real terrible concern. You have a couple of problems that are going on. Number one, you are seeing a significant decline in the standard of living of many people in Russia. They're hurting very badly. And those people are going to take out their frustration against Mr. Yeltsin. The worst thing I think that could happen there is if there was a restoration of an authoritarian communist type government. That would be very bad. And in the long run, that would cost us more money and more anxiety, because if that, and we don't know that that's the case, but if that authoritarian type government became belligerent, became warlike, then we would have to increase military spending to confront that once again. We'd be back to where we were for the last 40 years in fighting the Cold War or over again. So I don't think we want to see that happen. Does Yeltsin need support and need help? I think so. I think so. How much I can't tell you exactly, but it is in the best interest of the United States of America that Boris Yeltsin, with all of his problems and his faults, remain as the leader of that country.
Should we be meddling that much in a government's affairs, or should we support the democratically elected head of a government?
The difficulty, that's a fair question, and the difficulty that you have, you say, well, some people say, and I understand that, it's not unappealing to me, why are we helping to support Russia? We have so many problems at home, right? That's not an illegitimate or illogical argument. The problem is, if Yeltsin falls, and we don't know that this will happen, you have an aggressive, belligerent, authoritarian government succeeding him, then what may end up happening is that it'll cost us more money to have to confront and stand up to that new government than it is helping Russia. Now, what is the happy medium by which we do not take significant sums of money from our desperate needs to help them, but at the same time try to maintain his position? That's the balance, and people will argue about that. But I think that Russia does need help, and that we should try to do what we can to keep Yeltsin in power.
Your discussions about cutting the superconducting supercollider on the V2 and things like that will only go so far. There's a lot more deficit reduction that needs to be done. What are some of the programs that you hold near and dear that you'd be willing to give up?
First of all, if in fact my ideas do not prevail, but the president is right and that we reduce our deficit by 50% over the next 5 years, don't kid yourself. That is a major and significant step forward. Now, if your question is, I reject the argument. You see, some people make the argument, they say, well, Bernie, everybody has got to have to suffer. We're all hurting. We're going to have to cut the programs for the elderly and cut the programs for the children and cut the programs for the working people. We're all in this together. But I just gave you some statistics. And what the statistics said is that in a 6-year period during the 1980s, the richest 0.5% increased their share of the wealth by over $1 trillion. Trillion. That is big money. So before this congressman asked working people and poor people and children to take further cutbacks in their standard of living, you know what? I'm going to go after that richest 0.5% who made out like bandits. So I reject the idea that all of us have to suffer. The rich made out like bandits, Working people and poor people saw a decline in their standard of living. What's incumbent upon the President now and the Congress now is to go after those people. Now, after you go after those people, if there's still more to be done, we can talk about it. But we've got a long way to go.
Can you give us an update on what's going on with healthcare?
Yeah. In 2 hours or less.
No, I mean, you've got some people coming in.
Yeah, okay, well, that's good. Yeah, we can do that. A concern that I have, we're changing the subject, so RJ asked that, and we'll go off to another area. Obviously, the one area that I haven't talked about of enormous consequence to Vermont and the nation is the issue of health care. You all know that Mrs. Clinton, the administration are working hard on health care proposals, which will be out within a couple of months. We have concerns. You also know that here in the state of Vermont, the Vermont Healthcare Authority is ostensibly looking at a single-payer system versus a multi-payer system as the option for Vermont. One of the concerns that I have observed is that there does not seem to be quite as much focus as I would have liked to have seen on the single-payer system. Seems to be a little bit more focus on the multi-payer system. This Friday, we have invited to the state of Vermont 6 Canadians who are physicians and healthcare administrators from Canada. And they will be testifying before the Vermont Healthcare Authority, who have been kind enough to give them that opportunity. We'll be doing a press conference, I believe, earlier in the morning. They'll be meeting, I believe, I don't know this for sure, with some of the leadership in the House and hopefully the governor as well. We think that it is important, especially given the amount of very negative publicity, and I think dishonest publicity that has come down about the Canadian system, that Canadians have the opportunity to talk about the positive aspects of their system, which are, in my view, many. Remember, the Canadian system is not perfect, but they provide health care to every man, woman, and child, and they end up spending significantly less per capita than we spend. So what we wanted to do is bring down people who operate in different walks of life within the Canadian healthcare system, administrators, physicians, to answer questions that people might have. As you know, it is my hope that Vermont will lead the nation in terms of moving forward toward a single-payer system which would guarantee comprehensive health care to every man, woman, and child, and not necessitate us spending any more than the $1.5 billion we are presently spending. Now, during this last week, you also noticed that the President has or will soon give approval to the Oregon program. Now, I personally, what's the good news there and what's the bad news? The bad news is that the Oregon proposal is really a two-tier system, which will ask the working people and the lower middle-income people and the poor people to accept rationed health care. If you're rich, you're going to be able to get everything that you want, because if you have the money, you can pay for it. But if you're working class or low income, your health care benefits will be rationed. That's the bad news. What's the good news? The good news is that Oregon has come up with a proposal that will in fact provide some health insurance to everybody in their state. Everybody will have at least some coverage. That's good. And the second approach is that and I've debated people from Oregon on this, but we have to concede to them, they at least have had the initiative to come up with a program. And I respect that. I like the idea of states or municipalities coming up with programs. Now, the good news for Vermont, I think, is that if the President is willing to allow Oregon to go forward, clearly what that suggests is they're going to give a lot of emphasis to state initiative. That means that it is very likely, we can't predict, but it is very likely that if the state of Vermont, for example, comes up with a better program than Oregon, a single-payer program, that it would be hard for the administration to say, we're going to override your efforts after we've approved Oregon's. So I think that sense is pretty good. That movement is pretty good to give states some initiative. So the good news there is I think what's coming out of the Clinton administration is a willingness to allow states to move forward with their own ideas. My hope is that Vermont will lead the nation and come up with the very best program, which would be a single-payer, universal, comprehensive program that guarantees health care to all of its people. So those are some of the things that are going on there.
Just one question on this. If it came down, Vermont was a demonstration state, and it's looking pretty good at the moment. And it ended up as a single-payer system. What would be your ideas for paying for this for Vermonters?
Sure. Okay. You see, sometimes it is not a complicated issue. Sometimes people can be a little demagogic about it, but it's not complicated. Right now, we spend about $1.5 billion for health care in the state of Vermont. About 40% of that comes from the federal government directly from Medicaid, Medicare. A lot of it comes from obviously private insurance, Connecticut General, Blue Cross Blue Shield, and so forth and so on. What this proposal does is it eliminates all of the private insurance companies, so nobody is paying private insurance. Employers are not having to pay Blue Cross Blue Shield, individuals are not paying private insurance. What it does do, so no one has to pay that anymore. That's the good news. What's the bad news? Obviously, your taxes go up. To my mind, because of the efficiencies inherent in a single-payer system, we can cover all people in our state without spending more than the total $1.5 billion. Where do the new taxes come from? I think you're going to have to look at more progressive income taxes. You're going to have to look at payroll taxes. Those are two of the areas that I would look at. How much, I can't tell you right now. In fact, I hope that I will be able to tell you with some specificity fairly shortly, but I think those are the two areas that you're going to look at. But what people have to understand, you know, our opponents will say, taxes are going to go way, way up to fund this. But what they're forgetting to say is the people are not going to be paying any more private insurance. Okay, so if a family now has to spend $5,000 a year out of their own pocket to insure their families, they don't pay that anymore. Will they have to pay more in taxes? Yeah, they will. In general, based on the proposals that we are advocating, the vast majority of the people should be better off in terms of total amounts that they're spending for health care. They will pay more in taxes, but that will be more than offset by what they are not paying in private insurance. So if you are paying $5,000 for private insurance, and you don't have to pay that, and you're paying $4,000 more in taxes, hypothetically, you're $1,000 better, and you're going to have a better insurance program. Okay? Wonderful. Always a pleasure, gentlemen. Ladies.
On a different subject, anything we can do about enlarging this room or getting some of the stuff out of this room so we have a little more room to move?
You mean so you can, after 15 seconds, run around and catch the back of my head in that important issue? No,
Absolutely.
we're intentionally doing this for Channel 5. We want them to say, focus, right on the issue. For the 6 seconds that you're going to be on, we figure it's important that you look right in the face.